vision, and a headache, and then vomits.
Increase.
Tell the doctor.
Okay, but what is your first action? You know it's
Action.
Assess assess
Elevate the
conscious.
head.
LOC.
so the answers that I have here are immobilize the child's neck, darken the room and put a cool cloth on the child's forehead, report this information to the physician, or restrict the child's oral fluid intake.
Physician.
It's a immobilize the child. Immobilize it.
Dark room, cool cloth.
What do you want to do for increased intracranial pressure?
Measure the.
Reduce their stimuli.
Yes, but is it gonna
LOC.
do anything to help them?
Raise their hand.
I mean, but like, if I'm in the moment, what would it be calling the doctor while they're puking help them? Like, in the moment.
Yes, we know in the moment. And then you'll have those questions where it'll be like, well, I'm gonna do all of those things at the same time.
Yeah. But I think it's the first is
Like, if
high,
you could only pick one, what do you think would be the most important to do?
I would put the patient at highest risk for seizures. No.
I would think it would be to let my doctor know
Yeah.
what's going on.
That's what I thought. Yeah.
Yeah, like get further orders, transfer level of care,
That's
do
what-
something before they have a seizure or,
Yeah.
Things that you could prevent.
yeah.
Which change in vital signs would alert the nurse to increase intracranial pressure in a child with head injury?
Blood pressure.
Dark
What vital signs?
Vital signs.
Oh, vital signs.
Yeah, what vital signs are gonna indicate to you have it elevated?
I guess like
ICP?
what, like assessment?
Is it you measure the head?
Late signs.
No, that one's blood pressure.
Is it the mop? Is it the mop, Professor?
Bradycardia, bradycardia. Oh, LOC.
What is the answer?
It's confusion and altered mental status.
So LOC.
LOC. That's what I said. You know,
Confusion and
The
mental.
late sign is
LC, mental status.
And then it's like, inconsistent respirations is weak. Or like the Chivex, what's that, check?
Oh, those are late signs.
Of
The
calcium.
late sign, like the latest hypotension.
Yeah.
Yeah,
That's not good.
yeah.
No bueno.
That's not good.
But it's hypertension in the beginning, right?
Yeah.
More or less.
Yeah.
Also,
Oh.
Depends on the child.
Yeah.
Yeah, sometimes they can be normotensive.
I've had that happen and they just drop. A nurse is performing a Glasgow coma scale assessment. Which assessment should the nurse not include? Eye-opening, verbal response, sensory, and motor.
sensory. Who's daddy?
Yeah. Okay. Did you guys learn about Guillain-Barré?
No.
No.
What is it though?
See, I've never heard it pronounced like that, but yeah, Guillain-Barré.
Yeah. I can pronounce things right.
I don't pronounce things right either, but my students will look at me and I'm like, potato, potato. Come
Yeah.
on, let's just keep moving here.
All right. What should the nurse expect? Which CSF laboratory results on a child diagnosed with bacterial meningitis? What would you find?
Cloudy, low heart puncture.
Clear,
Okay.
Also, high,
runny
levels
nose.
of, white blood cells.
Yeah.
Yeah.
What else?
It's dark and cloudy.
There's one more.
No,
What's
we're
that?
actually
No,
your
lab.
CSF.
You're looking at your CSF and you're
Oh,
examining it.
oh,
Glucose.
Glucose.
Yes.
Glucose.
Great job.
Good job.
Oh, more meningitis. Do you guys remember the different physical assessment signs for meningitis?
Isn't it the Brudinski?
Yeah, Rudinsky's and what else? Kernig.
Kernig, yeah.
You guys have like a concept of what those are?
Brudinski's in each chair. Like,
Yeah, see, they tilt their head up and they like curl up.
yeah.
Those are like the psych ward.
No, these are signs of meningitis.
I know, like, I've gone to the psych ward and like,
Yeah, I just like that.
Also that position that the baby cannot, what is the name of that position?
Oh, OB something.
Because they cannot,
That's for the babies.
Yeah, they like arch.
that they,
it looks. I think it's opposite.
It does look like
No,
it's
it's
that.
in the book. The baby is
it's
like.
on the book, it's on his neck, like this.
And which
Off
one's worse,
the side.
bacterial or viral?
They can be both.
Wait.
Meningitis can be viral and
Yeah,
bacterial.
but which one's worse?
Bacterial.
The bacterial one, yeah. Because actually for viral, they don't give it any specific medication, they just help them with,
Like some
symptoms.
Medicare, because there's not really, I don't know.
So it's, again, as pronunciation, is the office bonus? But
It's like that, yeah.
Were you guys just talking about?
Alright, after a tonic-clonic seizure, it would
Okay, no,
not
like,
lift
I
your
can't
leg.
pronounce that.
Tonic-clonic seizure, what would not be unusual for a child to display which symptom? Irritability and hunger, lethargy and confusion, nausea and vomiting, and nervousness and excitability.
I think it's the first one. Which one, can you repeat it?
Yeah, can you repeat the question?
After a tonic-clonic seizure, it would not be
Oh,
unusual for a
after.
child to display which symptom?
Ah,
What happens after a seizure?
The postpartum, the relaxation,
What is this phase called?
post something, post postural.
Yeah, post.
Postdictal.
Postdictal.
You're right the first time.
Yeah, so what are they like postdictally?
Lethargic.
No, the sleepy, tired,
Mhm. Yeah,
lethargic.
and it's okay if they sleep.
Yeah.
Alright. What is the most appropriate nursing action when the child is in the tonic phase of a generalized tonic-clonic seizure? A. Guide the child to the floor as if he is standing up and go for help. Turn the child's body on his side. Place a
That
padded
one.
tongue blade between his teeth or quickly slip soft restraints on the child's wrist.
No.
It's a term
No.
Yeah. Why would we turn him onto his side?
for airway.
Yeah.
You guys know we used to do that with the tongue blade?
You don't put anything in the mouth and you won't know.
No.
We used to do that, that was like standard of care way back.
Now we don't do it.
I got bit doing that.
Don't do that.
Yeah.
A child is aroused and when aroused responds briefly before falling asleep. Which
Obitotis.
corresponds to this level of consciousness?
Obtunded.
Obtrusive.
Yeah.
Obtrusive. What'd you say?
Of something.
Of something. If I see it on the exam.
I'm a great test taker.
The mother of a 5-year-old child asks the nurse questions regarding the importance of vigilant use of sunscreen. Which information is most important for the nurse to convey to the mother?
For sunscreen.
Sunscreen.
Yeah. Why would you use sunscreen?
Bubble sensor.
Well, that's cancer.
Skin cancer.
Yeah. That was easy. Did you guys learn Wilms tumor?
Yes.
Don't palpate the abdomen.
Put a sign on the bed, don't partake.
Don't touch the abdomen. A child diagnosed with Wilms tumor. In planning teaching intervention, what key point should the nurse emphasize to the parents? We already said it. Don't touch the abdomen. Yeah. Oh, the parent of a child undergoing chemotherapy asks the nurse why the child must wear a mask in public places. Which of the following responses would be the nurse, responses by the nurse would be the most important and appropriate?
Prevent
Inappropriate or?
Appropriate.
to prevent infection.
Yeah.
Avoid crowd.
So why are we wearing masks in
immunocompromised.
crowds, in crowded areas?
Because they have low immune system, low.
Compromised immune system.
Suppress immune system.
Why are their immune systems suppressed?
Cancer, anything.
Because of the treatment is suppressing the blood marrow.
Everything.
killing the good ones and the bad ones together.
Is
Los dos
chemo,
juntos.
is cancer contagious?
No.
No.
Some people will ask you this.
Well, there is one that is contagious. The one that is from the female. What is the name of the HPV? Yeah.
That's a virus that can
I
cause.
was gonna say, so that's, yes, that's a virus that can lead to cancer, but it's not cancer that's contagious.
Okay.
It's the virus that's contagious.
But there are several viruses that are contagious that can lead to cancer. Why do you guys get hepatitis B vaccine?
So we don't get.
Right, so you get hepatitis B, but why is it really important for hepatitis B vaccine when you work in healthcare?
Accidental needle stick.
Blood exposure, fluid exposure.
Feces.
What's really interesting about hepatitis D?
You only
You
can
have
get
to
it
get
if
from
you have
B.
B.
Yeah, and what does hepatitis D cause?
Same thing as A.
Chronic.
Hepatitis
Same
D
thing as
actually
B.
causes liver cancer, right? So there's lots of different viruses that can lead to cancer, right?
Alright, a nurse analyzes the lab values of a child with leukemia who is receiving chemotherapy. The nurse notices that the platelet count is 19,500. Based on this lab value, what intervention would
Put on
the nurse
isolation.
document? Platelet count?
Risk for bleeding. High risk for bleeding.
There we go.
Yeah. Why would we use a soft toothbrush?
Easy to use.
Yeah, because
I wish those questions can come next time.
Because they're on chemo too, right? So they get like the little mouth sore.
they can get mouth sores with the chemo as well.
You think they'll make it this easy?
But yeah, if you think platelets, you're gonna think bleeding. White count, if their white count's low, they're gonna be more susceptible to infection. But this is asking about platelets. So make sure you read the entire question.
Yeah.
Especially with the lab ones. What's that?
The white count. So like if it's over 10,000, that means they have an infection. Like if it's high,
Most of the time.
okay.
It's got a good indicator.
Okay, but if it's low, that means they're healthy.
No.
Right, so if it's normal range, who had you? You had 24. What was your baby's white count?
No, I have, yes. It was low because that's the reason that he didn't, but I think I put it right here.
Surgery on her patient because
Yes,
his white
they
count was like
cancel-
2.2 or something.
Yeah, I got it. Hold on.
And so it's too low, so the concern is that his immune system.
It was 3.7.
Okay, that it's not gonna respond appropriately.
No.
And there's with white count, you could also consider neutropenia, which has a whole other ballgame because in chemo patients, we're worried about fever and neutropenia. And if they're neutropenic, they should be admitted to the hospital. Should be.
No comments.
Yeah. No. A child is diagnosed with Wilms tumor. During assessment, the nurse in charge expects to detect what?
A pain.
Also what?
Enlarged abdomen.
Big liver.
Mm-hmm. But what if you can't? This is an assessment.
You can't pee.
It's gonna have one side of the abdomen.
What's the
larger,
question?
Like
A child is diagnosed with Wilms tumor. During assessment, the nurse in charge expects to detect what?
A big
A big
kid
mass
liver.
in the abdomen,
Yes.
maybe in the kidney.
One-sided bigness.
No one's gonna forget that now.
One-sided bigness, you guys.
Oh
my gosh.
So the rationale behind the, you're gonna find a painless, palpable abdominal mass, sometimes accompanied with increase in abdominal growth. So you can anticipate in order to measure their abdominal growth every 12 hours, average after whatnot. Gross hematuria is uncommon, but microscopic hematuria may be present. Dysuria is not associated with Wilms tumor, and nausea and vomiting are rare in children with Wilms tumor.
Do you guys know the difference between gross hematuria and microscopic hematuria?
when you can
Gross
see
is
it,
big, one is
now
small.
You can't see.
You can see both, but what do you need to see?
A microscope?
A microscope, yeah. Yeah, so one is like,
You
oh,
can see it with your naked
You
eye.
studied
what
that.
is that?
You
Bloody.
studied.
And then the
I
other one
always
is like,
studied
oh, looks
too, man.
okay.
I take
And then
no
you send it to the lab,
chances.
and the lab's like, no.
I know you studied too, but
Alright, a 15-year-old has been
study.
admitted to the hospital with a diagnosis of
Not
acute
everything is easy.
lymphocytic leukemia. Which of the following signs and symptoms require the most immediate nursing interventions? So
Infection,
what would
Fever.
require your most?
fever,
Yeah, what else?
bone muscle pain,
Looking for a specific
Joint
word.
bone pain.
Wait, what was that? Bruising, bone marrow suppression, hair
Vomit.
It's a
Respiratory.
specific kind of rash.
oh,
Oh, petechiae.
Petechiae.
How do you say that?
Petechiae.
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 Potato,
Boy,
I know how.
So if you see a kid with ALL
that's
and he has fever and petechiae, what do you want to do immediately?
Say it again, Professor.
Precautions? Find another nurse.
What is the best response to a father who tells the nurse that his son daydreams at home and his teacher observed this behavior at school? A, your son must have an active imagination. B, can you tell me exactly how many times this occurs in one day? C, tell me about your son's activity when you notice the daydreams. And D, he's probably getting tired and needs a rest.
B.
B. The current,
B is, can you tell me exactly how many times this occurs in one day? It's, tell me about your son's activity when you notice the daydreams.
C, C.
It is C.
I
Why
think
would
C.
it be, tell me about your son's activity when you notice the daydreams?
Because you want to make sure like they lose it. They're just
It's not a pattern.
they're
Like
not responsive.
they want to
What
see
kind
like
of-
what are they doing before this happens.
Oh,
Basically, what is happening?
Well, like what kind of like seizure would you anticipate like?
Absent
like,
seizure.
staring off into space? Yeah,
Focus.
yeah.
Absent.
Yeah.
Some providers will just run off daydreams.
Oh, yeah.
Oh, yeah. Absent seizures are hard to catch. Let's see.
I would say, let's see, hydrocephalus on this one?
Yes.
Do you guys know some of this, like, assessment signs for hydrocephalus?
If the child is distracted,
High pitched cry.
sunset eyes.
Hypertension. Tachycardia.
Motion.
What was
Motion.
Yeah, if they have fontanelles, they would be bulging.
for
Would it be
sunset
I
yellow?
eyes?
think when you put the shunt is when the patient has distracted and he doesn't eat, is when you have to pay attention, right? After you implant the shunt,
Like behavioral change.
behavior changes, right?
Yeah. I saw a patient with a shunt.
Oh, really?
I saw 6 times.
You're talking about like shunt malfunction?
Yeah, for the.
Yeah.
Yeah,
It
so
was too.
vomiting.
Oh, no, I didn't know that.
The vomiting's a big one for shunt malfunction. Fever can indicate infection of the shunt. Also, look at your vital signs because what could happen if your shunt's malfunction?
The MAPES would be respiratory
Sepsis.
depression.
Mm-hmm.
Sepsis
So what happens to your ICP?
increases.
Yeah, right, your shunt's not working anymore, so they get increased,
Cranial
intracranial pressure.
pressure.
And then you get all of those symptoms that come from increased intracranial pressure.
So like in my world, in the ED world, if a kid comes in with vomiting and they say they have a BP shunt, it's a critical care immediately. They go back because they could have a shunt malfunction. They need the proper examination to see if it has malfunction before it gets to that point. Yeah. Yeah. What is the most common pediatric cancer?
Leukemia.
What kind of leukemia?
ALL.
And also is the more successful for prognosis.
I know she
When it's
reading from
within a
off the
certain
test.
age.
Tell me then she reading from off the test.
It's acute leukemia.
So with
ALL.
hydrocephalus, they get a shunt. Is it one shunt and done?
No, because they grow more and more,
It
so
could
it has
be,
to be
yeah, but
like
it cannot.
replaced and
Most of the
surgery.
time they will probably need more
revision.
surgeries. I mean, imagine how much a baby grows between 1 year of
Yeah.
age and 10 years of age.
Yeah.
I don't care how much room you left in that shunt, but it's not enough. Right, so they'll likely need more surgery, so it's a good education point for parents. Honestly, pediatrics, a lot of what you're gonna do is educating the parents and re-educating your parents. And re-educating your parents. Okay, let's see. Now we talked about ICP on that already.
You guys need brain tumors?
Yeah.
Okay.
Yeah.
The post-operative care of a preschool child who has had a brain tumor removed should include which of the following? A, colorless drainage that is to be expected. B, analgesics are contraindicated because of altered consciousness. C, positioning on the operative side in the Trendelenburg position. And D, carefully monitor fluids due to cerebral edema.
That one.
Yeah.
Or like, I don't wanna say that
easy.
again.
Yeah.
Do you guys know what type of isolation for meningitis?
Droplet.
Droplets.
What does that entail?
Gong, gob.
What else?
Possible gown, possible. Possible everything.
A face shield.
No,
Somebody in the back said it.
Face shield.
Yeah, I know.
I would want a face shield.
Kids are gross. They'll sneeze right in your
Yes,
face.
and then your face.
They will absolutely sneeze right in your face.
So if you work inpatient, you get the luxury of like, you know their diagnosis. We've had a meningitis, like luckily it was viral, but like in a sense if like you were in contact with somebody with meningitis, the reason why we gown up in like our trauma bay, we don't know what they have. But most of the time, like, I go into a patient's room, I don't know what they have. They could have COVID, and I'm going in there like in just my scrubs because I don't know. But that's ER, you know. But if you get into contact with meningitis, bacterial meningitis in the ER, they'll just treat us prophylactically with some medicine.
Work pays for that.
Yeah, work will pay for that.
Yay.
They should.
Yeah.
You'd be surprised.
They should.
You would be surprised. You would be surprised.
Yeah.
You would be surprised. Okay, so you have a child that has a concussion. How long are they at risk for symptoms from it? Like, how long do you have to keep an eye on them?
24 hours.
12 hours?
72.
Every 2 hours?
Yes. 2 hours checking on him. Wake him up. See if he has the LOC.
It is 24 hours though.
I think that the answer is a little bit longer than that, but it does include that number.
Oh, okay. So 24 to 72 hours?
24 to 72.
Okay.
24 to 72 hours.
Yeah. 24 to 72.
I don't want to be all like, this is the answer.
Somewhere.
Mostly because I'm looking at last year's exam too.
Oh, okay. Well.
Trying. Don't get me in trouble, you guys.
No. I'll mess one of you up.
She's like, I'll come for you.
Yeah, I'll come through.
I didn't hear anything. I don't
What
know.
happens in clinical stays.
That's why we love this group. Woo! This group.
Secrets.
You doing med surg too?
They ask me every semester.
Are
Do
they?
you have any more hours? And I'm like, no.
Absolutely not.
Why don't you want to do med
Anything
surg?
with Mr.
Okay, we already talked about how great this job is.
Oh yeah, that's right. We did.
Academia
talk
does
about
not pay well.
It does not pay well
Well,
at
thank you
all.
for doing it for us.
Yeah.
I like to teach
Mhm.
OB because that's what I do.
I like these better.
I get stuck doing peds because you're told when you take the position you do both.
Yep.
Dang.
Which is why we hang out together. Because I do OB and she does peds.
It's like salt and pepper together.
Yeah.
Yeah.
And then I'll look at her and be like, is that right?
Yeah.
It's peds, I don't know.
I've only done peds. That's what I wanted to do.
I did this much peds.
kind of same as Pete.
Well, so I worked in a women's and children's unit in this very, very small rural hospital. It was a 6-bed unit.
Oh my
And we
God.
could have anything from like GYN patients, postpartum couplets, peds patients. My very first peds patient was a 11-year-old who broke his leg playing football. That was actually one of the surgeon's sons, and of course broke it like really badly right across the growth plate. And he refused to let them transfer his son to another hospital, and he was trying to get the hospital administration's permission to fix it himself because he's
What?
an orthopedic surgeon.
Wow.
Yeah, I was like, great, first peds patient. And then my very next one was a Billy baby that had an apneic episode on my shift for like 45 seconds.
That sounds scary.
Yeah.
Did he fix it though?
I smacked it around until it started breathing.
Broken leg.
Wake up, baby.
No, I'm talking about the broken leg one.
What happened?
Did he get the fix?
So they
Did
transferred
did she read the
So
question?
we did the pediatric surgeries there.
Oh.
It was
Nice little
anesthesia was like, hell no. Maybe if he was like closer to 18,
We need
like
to study that
16,
some
17, they
more
might have played the game, but 11, they were like, mm-mm. That's easy one, we'll skip that. We talked about that already.
How about the sunset eyes?
We talked about that, where were you?
Oh,
Sleeping.
no.
That's with hydrocephalus. Did we talk about it? I feel like we talked.
Yeah, we talk about hydrocephalus.
No, but
What about
how-
Ray
Like,
syndrome?
I mean, like, how does it
Right.
supposed to
We
look?
do that, right?
So have you seen pictures of sunset eyes?
So it's
Kind of.
It's supposed to look like this. Like you're looking down like this, and the eyelid come down to the half, but the pupil looking down, and the eyelid is halfway. So it's like the sun going down. You know, you ever see the hair when the sun, but one thing is stop like
Help him out,
like
Twain.
this.
Twain. Look down at the floor by
This is
your
sun does
face.
the job, and with the high halfway.
Why are you crossing out?
Yeah, don't cross.
That's why.
Look straight down at the floor.
Like this.
They lose the inability to move their eyes up, their pupils up. So their pupils and
Just like dilated
irises
kind
are
of?
It's just like
lowered
halfway.
down, like their
And you're like-
like their iris is the setting sun. Right?
Yeah,
It's
you
setting
see more
down.
white on the top.
Does that make sense?
Yeah. Oh, okay. You see, like the scleros more.
Yeah, it looks more clear because like the colored part of their eye is setting, right?
Mm-hmm.
What is the definition of confusion?
Lots of mental status.
What else?
I think it's
Confusion.
the second level of the
Disorientation.
second level. The
AMS.
first one is
Are they alert and awake?
alert.
Yeah.
They are.
They're not alert, but they're awake.
But not all the way to the alert. But
They
they're
are
alive.
alert
They are alive.
and they're awake, but they're confused.
They're not all there.
They're inappropriately asking, like, answering questions. So if you ask them a question, and they inappropriately ask, like, oh, where are you? Oh, I'm at home, they're in the hospital. Things like that. What's stupor?
Like,
Only around
One before coma.
Yes. But how,
Pain.
yeah, and
like if you touch them, they kind of respond, but
like if you, like, if they're waking the sternal rub.
Yeah.
Yeah.
That's a me smacking my baby that was happening.
What's a febrile seizure?
Yeah.
Is it chronic?
No, not necessarily, but it could be.
It usually resolves by
If you have chronic fever, then maybe.
So I think what she's trying to get to is, will they have seizures for the rest of their life?
Will they be
have
diagnosed with
febrile
a
seizure?
seizure?
Yeah.
no.
Not necessarily.
Will they ever have another one again?
Maybe.
Probably not.
They don't know.
Usually they're isolated incidents.
Really?
Usually, yeah.
One and done,
A
right?
one and done kind of thing. How high are their fevers when we're talking febrile seizure?
Or like 105,
Yeah, like 105, 106,
106,
107.
yeah.
Easily.
Gosh.
Not like 103 or 109.
We see the 103, 104s in the ER
And they're fine.
all the time, and they'll be playing.
Yeah.
Oh, okay, so that's a question. Do you treat the fever or the patient?
the the patient.
No, you look for what is the problem, right?
You treat the patient.
Yeah.
What does a fever do to your body? What is the
It's a
purpose
good
of
thing.
fever?
It is a good thing.
Yeah.
Right? Yeah, so if your kid is eating, drinking, playing, watching TV, having a good old time, and their fever is 102.9, are you gonna necessarily treat their fever?
No.
No, that's fighting the infection.
Yeah, it's doing what it's supposed to do. If they are 100.8, but they are a slug and they don't want to eat, they don't want to drink, they don't want to do anything, are you gonna treat their fever?
Mhm.
Yeah. Yeah, so it's not necessarily with kids particularly.
It comes like, that's when the nurse needs to educate the parents, because parents will automatically think fever's bad. Automatically think it's bad. But we try to explain, it's like, oh, that means their immune system is working properly. Like, this is a good thing. They'll still panic because they're afraid of seizures because they get that from the news and like they think that.
Oh, and my sister's cousin's daughter's sibling had a seizure once, and now she's in a wheelchair, and I'm like, no,
That's not how it works.
no.
Yeah.
But that's, no, you laugh, but that's literally
That's
how
how
they
it
come
is,
in.
yeah.
Well, my so-and-so, so-and-so, so-and-so.
Well, weapons beats a bit.
Oh, no, they absolutely
Obviously
will.
has cancer.
Yeah.
Cause I wouldn't even have thought of this question. Again, this is last year's time. So acute Ray's syndrome, what's your primary concern?
Aspirin.
As a parent,
As a nursing assessing your patient, we know aspirin crasses.
Liver toxicity.
You can call
Toxicity
swelling,
cares.
ICP.
So what kind of things happen when you have Ray's?
Also toxic.
You could cause ICP. You could cause liver toxicity.
So liver, right, that's a big one, right, what else?
Is it ringing in there?
What about ICP increases?
Yeah, so it causes brain damage, right? So what do you think is more important in the initial acute phase?
ICP.
Your brain, right? So loss of consciousness, change in mental status, those kind of things.
Okay.
Yeah, I can't read you the answer, but just think brain before liver.
Okay, right before liver.
Yeah.
Well, that makes sense.
It does make sense, right?
Yeah.
What are your nursing priorities for a child with a traumatic brain injury?
To mobilize the head, protect the child.
Isn't it like keep the spine neutral or something?
Yeah.
Spine
Right
straight.
Mhm. What are you looking for?
A low
You look for, yeah.
Brain bleed.
Oh, there's pupils?
Bleeding in the brain, TBI, dilate,
Um,
confusion.
I'm looking for Cushing's triad. What is that?
Oh,
bradycardia.
pressure gap,
Widen pulses.
wide, yeah, Brady, Brady, what's the other one? Come on, guys, bring it
Irregular
up.
heart rate.
My brain hurts.
You're on the right track. Irregular, not heart rate, but irregular what?
Oh, breathing.
Yeah.
Okay.
What is it again? It's
Irregular
So
breathing.
widened pulse pressure,
Wide impulse pressure.
bradycardia, irregular respirations.
Okay. Those are the first or the late?
Those, your late is going to be your blood pressure. That's like the late, even in like septic shock, that's your late sign. Cushing you can see pretty early on, except your widened pulse pressure. That's kind of like the big one.
Okay, so we talked about this one, but I'm gonna talk about it again, because I know these are the type of questions that really flabbergast people on exams. So you have a baby, 9-month-old, that has increased head circumference, bulging fontanelle, crying, at rest. What's your priority nursing action?
Call it up.
Call a doctor, right?
Yep.
So I'm telling you, the options here are all options you guys gave, right? Seizure precautions, quiet environment, lazy baby flat, like all of those are here. What is your priority? And you can do this while you're doing those things. We carry around little phones at the hospital that you can call the doctor while you're doing all these other things. But your priority is to what?
Call that.
Yeah, get more help. We talked about that.
How many questions?
65.
Oh, I'm on 8.
Danny been ready.
I just want you guys to know that there have been
We're not friends, though.
information regarding a 6-month-old client. Your options are the child has a heavy head, undeveloped neck muscles, and thin cranial bones.
Yeah.
The child's nervous system is fully mature at birth. The child has underdeveloped fine motor skills, well-developed gross motor skills. The child grows from the feet up to the head.
Okay.
Yeah, A, but
Yeah.
this is not the first one I'm seeing. Their real developmental is such a big part of pediatrics. It's what differentiates it from adult nursing.
Yeah, but is she gonna ask us about Erickson's or Piaget?
I don't think it's gonna be that
It's not gonna be that direct, it's gonna be like, how does it relate to the type of care that you're providing, right? Like, so education that you're providing to a patient with leukemia is what sort of things are, activities are appropriate.
like how you're gonna treat a 5-year-old is gonna be different than a 17-year-old with leukemia.
Right.
I think
What
it's
you're
like
gonna say, what pain skills you're gonna use.
Or also check the fontanelle if they.
Yeah.
Right, does 5-year-old have fun now?
No.
Right. That kind of stuff. I did see one on sickle cell, like what sort of activities are appropriate based on that age, right? So one, you have to know what activities are appropriate
Swimming.
for sickle cell.
Mhm.
Also, what activities are appropriate for that age.
Which blowing bubbles, that's the big one for like the little kids, acute chest syndrome, if they can't do the incisive parameter.
Love blowing bubbles.
Makes them take deep breaths. What's the difference between radiation therapy and chemotherapy?
one is pill and one is
Radiation.
What is the high energy?
Well, chemotherapy is not always just a pill. It could be IV,
Could be sub-Q,
could be
IM.
intrathecal as well.
Yeah.
One's inside, one's outside. External.
What does radiation therapy use to damage and kill cancer cells?
Sound. Radio waves.
Yeah.
Radio energy. Radio waves.
So they do inject certain chemotherapies in a localized fashion. It is generally considered more systemic, but you can
You want more?
also do whole body radiation, and then they can do targeted radiation. So I wouldn't use that as your differentiating factor. Yeah, I would radiation use radioactive waves.
And biologic therapy is a new one. Use of biological agents to activate the immune system to treat the cancer. Gene therapy and vaccines even. So think about that. And then bone marrow and stem cell transplantation is kind of like our last
So
step. Yeah. Not necessarily our last step, because I've seen kids not do so well after bone marrow transplant, but that's pretty much, they go through their transplant and like their regimen of chemotherapy and they don't respond as you want to. Sometimes bone marrow transplant is one of the only ways, which is sad.
So a couple of these questions have been like medication related. I know that makes everybody so super happy, but they're like easy medication, which is why I haven't addressed any of them, like side effects of medication. One of them was like about abruptly stopping anti-seizure medication. Is that yes?
No.
Right. This one is about, this one is about dental hygiene.
Beta-toxylin.
Oh, that's for the iron.
Right, so like just know some of the side effects for some of the medications, because the questions are kind of, again, I'm trying not to get myself in trouble here.
It's the iron supplement.
Well, we
A
can-
13-year-old who was diagnosed with cancer, let's say leukemia, what interventions would you do, like psychosocially,
For what?
for a
Involve them in
13-year-old who
their
is diagnosed with cancer?
Involve them in their
Video games. Same person with the same disease process.
What do you mean?
Same person. Introduce them to the same person. Let they talk to somebody with
Like a
this.
support group?
Yeah.
That's a good option, yeah.
Video
Also
games.
give them a hot cover, they lose their
non-farm
hair.
interventions.
You can, they're not gonna lose their hair right away. People think that like once you start chemotherapy, you're gonna lose your hair like immediately. It kind of just like trickles out. Most kids will determine to like shave their heads before, because it's kind of traumatizing for them to wake up with like hair
Hair
on
in
their
their bed.
pillow and in
Or
their
when
bed.
they shower.
Yeah, it'll just come out in clumps. It doesn't just fall out. So you can give them the option to either shave their head, get a haircut, put it up in a ponytail,
Yeah.
whatever they want to do when they
And they
start
have
chemo.
that control over the
Yeah.
situation.
Some kids will just let it kind of come out in clumps, but
Yeah.
some
And
just
just go around like a little mangy dog.
Yeah. Yeah.
I know.
Some will shave their heads, and then I've seen in like my experience, We had a 15-year-old who lost her hair and her dad shaved her head. He said he shaved his head in support. Yeah, solidarity.
And nursing care.
Hygiene.
Oh.
Yeah, hydration.
Skin breakdown prevention.
Make sure you turn them.
Who had our little resident mayor last week? Yeah,
That was me and Andre.
The Lee syndrome kiddo?
yeah, what else did we do with him?
We did G2 feeding.
But what else did we do with him?
Oh, the eye drops.
Yeah, right, so oral care, eye care, really, 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 really important. I'll tell you that from a person whose dad came home after being on a vent in the ICU with really bad oral lesions. Oral care, eye care,
Hair care.
really important. I mean, hair care is great, right? I mean, who wants to be with slimy hair? Right, exactly.
Well, some of them, like, if they're not, like, brushed, it'll get matted.
And then and then they leave the ICU looking like a stray dog. For real though. What else do you think you would have to do? There's one thing you guys didn't cover, for a coma patient. Or a patient that was like sedated on a vent in general, just.
ABC.
Make sure you don't discuss this stuff around them, if they might be able to hear you.
Well, yeah, I mean, they could potentially.
What about
Pain-free
reposition?
pain-free care.
Pain, right, pain,
Yeah.
right, because we're like, it's okay, they're not feeling pain. Is that true?
No.
Right, yeah, so if you're doing something that's a painful procedure, you should treat them like it's a painful procedure.
So
like
talk to
you
them
already-
and tell them what you're gonna do.
Yeah, talk to the patients.
Yeah.
Absolutely talk to your patients.
I heard a lot of them, when they recovery, they said that they were, they can hear everything.
Yeah.
Play the music.
Yeah.
Oh, yeah, dude, that's what we did with my dad when he was in the ICU.
Yeah.
Hooked up a little TV remote with the music. God, I hate country music, but he loves it, so. Ooh.
Hey.
I know, getting there, we're getting there.
This is good studying right here.
I mean, I don't know who else. you
It's
know
a
who
good
could look at
critical
this down.
thinking,
Oh,
Professor.
this is a good one. A nurse is assessing a 1-year-old for did we go over this?
No.
No, we didn't. A nurse is assessing a 1-year-old child for increased intracranial pressure. Which signs should the nurse assess for this child, for the age of this child? Headache, bulging fontanelle.
Fontanelle.
Tachypnea, or increase in head circumference.
Increase in head. Wait.
Okay.
How old the patient was?
He's 1 year old.
Fontanelle.
1 years old?
1 year old. Remember, Fontanelle closed at 2, so he's good.
So yeah, anterior fontanelle.
I think we're
Me and Denny's not friends.
What are the choices, Professor?
Headache, bulging fontanelle, tachypnea, or increased head circumference.
Head circumference. Head circumference.
So the answer is actually A.
What?
Yeah, fontanelles.
Wait, what's it?
Was it A?
A was fine.
Because remember Professor emphasized when she brought the bowl, and she said when cranial, you're talking about ICP, right?
Yes.
She said this is the first thing, and she let us touch. That's what I remember.
So your fontanelle is like your window to the brain.
Yeah.
Yeah, when you think about it. So for a 10-year-old child, they would have a closed fontanelle. For the 1-year-old, they may not be closed, especially if one closes early, the other one closes later. A 1-year-old's not going to tell you if they have a headache.
Right. Not that one.
That's another reason why your developmental stuff comes in handy. You can eliminate answers.
Without no the answer.
So what was the answer for that?
Yeah, you can
It's
say, I
bulging
know
fontanelle.
So,
Because it's he's the
so
right one.
Fontanelle always
They
between 2.
close.
They close at 2.
When does
2 months.
18
The back one
months.
closed at 2 months, and the first one
When did
closed
you
at
close
2
your
years.
fontanelle close?
This is the first one.
So the first one closed at 2 years,
No,
8,
back one.
2 months,
Yeah, 1 to 2 months, and the anterior is about 18 months.
18 to 2 year, but most people say 2 year.
Yeah.
But just remember,
And
this,
then
because
a
it's
change in respiratory patterns.
intracranial pressure, so if it bulge,
So
only
your
if,
earliest
And I
will
could
be
if, it,
My
if the
head
baby at
circumference
rest,
would-
if it's not
I mean,
crying
that's-
or doing
You're gonna measure
anything,
that.
and it's
Yeah,
flat,
but
it's
how
good.
long
But
do you, how much pressure
yeah.
you think's gotta be in there?
it's like
to be
telling you that fluid in the brain because that's water right there coming out.
Yeah.
So
right.
remember,
So if you have a
2
Fontanelle,
years old.
Yeah.
yeah, I would go for that. Call you back. She'll call again. She'll call again. Priority nursing interventions with status epilepticus. Priority nursing interventions for status epilepticus.
Priority for epileptic.
Like, so what do you think is the most important thing?
Safety.
Airway and then safety. Don't let them get hurt. Yeah, airway, and then safety.
Airway and then safety.
A 2-week-old infant is seen for irritability, poor appetite, rapid head growth, and observable distended scalp vein. The nurse recognizes these signs as an indication of what condition? A. Hydrocephalus, SIADH, cerebral palsy, or Rey syndrome.
The first one.
Ray syndrome?
I didn't hear
The question?
Yeah.
When a 2-week-old infant is seen for irritability, poor appetite, rapid head growth, with an observable distended scalp vein, the nurse recognizes these signs as an indication of which condition?
A.
Yeah, the water.
Hey, just set
the
that.
retention of, not water, but the retention of mucus. Yeah.
Yeah.
Yes,
So I know we talked about the decorticate discerebit. So now I'm gonna show you a picture of it. Do you guys know how to describe those positioning?
yes.
Yeah.
This is the cord.
Extended.
Like, how would you describe that?
Abduction would be,
Oh, that's a good
Yeah.
Yeah.
because you're adding to your body.
Yeah.
The other one is extended and pronated.
That one extended and pronated. For the,
Cerebrum.
the
Yeah, it's like
cerebral.
we're pulling you back to
Cerebrum.
anatomy and physiology.
Yeah. How do you position a child for a lumbar puncture?
Sideline.
Squeeze everything to the chin
What
down
is
to
a
the.
lumbar puncture? Where do they insert the needle?
In the L4 and 5.
It's L something.
L4 and L5.
The lumbar.
Iliac,
Oh, iliac crest.
iliac crest, right?
No, that's a bone marrow aspiration.
That's our bone marrow.
Or the lumbar.
You guys say that, not me. Just kidding.
So
Or so-
knees bent and chin tucked into the knees. So you're gonna try to like C, like a C.
Is it between L4 and L5?
A mother reports that her child has episodes in which he appears to be staring out into space.
Absent seizure.
Good job. Do you know the differences between all the seizures?
I think so.
Let's go over that. Let's go over that.
Let's do it.
All right. What is tonic-clonic seizure?
Both tonic and clonic.
Yeah.
Wait, what?
What?
What
What?
are the correct seizures?
Oh, tonic, clonic.
Okay.
Generalized.
Focal.
Oh, yeah.
Focal. Oh, I thought it was falling.
What is it?
Yeah, that's what I thought too.
Like falling, clonic, tonic.
So we went over febrile seizures.
Oh, that one too.
Yeah. What's a partial seizure?
It's happening only one side of the head.
On the body. That's true. And we do focus assessment for that one.
Can we repeat which seizure that was? I'm sorry.
That is a partial or focal seizure. You can use those kind of
It
intertwined.
only affects one side of the brain.
Yes.
Yeah.
All right. Absent seizures or petite mal.
Pardon?
They're formerly known as petite mal.
So what's an absent seizure? What does it look like?
It looks
They
like
zone
seizure.
out.
Yeah.
Like disoriented?
Not responsive.
Not responsive?
Yeah,
Like mirroring.
but not moving or anything.
The high
What
bobbing
about
for
the eyes,
10
Professor?
seconds.
The eyes, they are like, when they're pointy, I forgot about
Dilated.
They can just look like they're staring out in space.
And is it a eyelid kind of like Bobby Eli?
Not necessarily. No.
Yeah, point,
If their pupils are pinpoint or below, that's bad.
That's bad.
That's an indication of like a brain injury,
Yeah.
not like a seizure.
That's a seizure.
Yeah. Tonic and atonic seizures.
What
Is
happens
it-
with them?
That's like Ford, right?
Is that the one where I have a lot of water?
Tonic, like you're stiff? I don't remember. What was the question? What was the question?
What's a tonic and atonic seizure?
Tonic and.
It's like they have
tonic?
slight convulsions.
Atonic.
Atonic. Oh, I didn't know that.
I don't know.
I didn't
Listen, she
know
told us
that.
we didn't know how to diagnose seizures.
No?
No.
Tonic.
I
So
said
we
we
don't
don't
spend too much
say
time on it.
Tonic.
Yeah, then you
I
ask
think
that.
the most important ones to know for peds are your absent seizures, your focal, and your tonic-clonic. And what is a diagnosis of epilepsy mean?
More than 2 seizure in an hour.
Like 5 to 6 a day?
No, it's like.
More than 2 in like 24 hours.
In 24 hours.
Yeah, because you can have a seizure and just have a seizure. Just because you have a seizure doesn't mean you have epilepsy.
Right.
A seizure you only happen like one time and that's it. One and done.
Epilepsy is like the chronic condition.
Yeah, yeah, so, what she's trying to get at is it's not like I have this many seizures per day, but it's like an ongoing issue. Like, I had a patient with Pitt's disease, and she'd come in for a potential febrile seizure and ended up seizing like 3 more times on me that night before we transferred her out. And then she continued to have seizures at the children's hospital, and was on a vent, and all the things, and then went home and never had a seizure again.
Wow.
We're good.
Yeah, I mean, that's awesome, right? But, I mean, she doesn't have epilepsy because she had 12 seizures during that hospitalization.
But it
She
has
got
to
them
be
all out
over
of the way.
time.
You have seizures, you have seizures.
Do you need to know medications?
Yeah, a little bit.
That's what
There's
she
a
just
couple.
There's a few that you need to know.
There's like fentanyl.
Pentatoxin.
Yeah.
Your sulfate.
Phenytoin.
Ah, Jordan.
What are those side effects
Phenytoin.
for phenytoin? I think it's bone, are something
That's the one we were
related with
talking
bone.
about.
Yeah, you said phenol.
Oh, like we wanna have.
I can't pronounce it, but I was close though. I was see.
Closer.
Yeah.
Nutritional or dietary.
Yeah.
You wanna drink milk or something.
What
You
kind
don't
of,
drink milk or iron supplement.
Orange juice. Or orange juice.
You drink orange juice.
I think those are calcium.
No.
I think
It's
we're
weight
all-
loss.
any medications that you can think of associated with sickle cell?
Hydroxyurea.
Yeah.
Pain medicine.
Definitely pain medication. Depends the level
Pain
of
medications, right?
the pain.
Yeah.
Morphine.
What other medications do you think could be relevant with sickle cell?
Fentanyl.
Hypertonic solution.
Just pain medication in general.
Usually they get admitted with a PCA pump.
Acetaminophen. To start with the levels are not high.
You can give them Motrin. It's cancer patients that you can't give any Motrin. Yeah. If we give Toradol to patients with sickle cell, Motrin won't do anything.
Yeah.
Toradol, we give morphine or Dilaudid. We give also intranasal fentanyl. A lot of them will be admitted to a hospital if they're really, really bad crisis with a PCA pump.
What about antibiotics?
Oh my god. I
You
know
give
this-
them
people that have
prophylactic.
Penicillin unless they're allergic.
Yeah.
What is it?
Yeah.
Penicillin?
Sickle cell, right?
Yeah.
Yeah.
Good job.
Yeah.
Penicillin
Yeah.
prophylactically.
Yeah. For what? What do what do they need to know?
Prevent pneumonia, like.
Take all of them. Is that for the like the blood? Prescribed.
But like they're not on penicillin for like their whole childhood.
It's until 5.
Well, for what?
For vaccines.
Vaccines. What else?
To manufacture, to fight against like.
Yeah, but like they're going to do what? Maybe give them some penicillin. Again,
Oh.
they're not going to live on penicillin their whole early childhood.
They're going to chemo.
What?
We talked about if they're going for vaccines and things like that. There's one other big thing that they do a lot is small children that they have to be on antibiotics for.
Don't tell us which one.
Key. Or gum.
Dentist.
The dentist, yes. They have to go on antibiotics before they go to the dentist.
Why though?
Yeah, but how long do we do it
Okay.
for? Till 5.
Oh, is it because
Yeah,
of?
so that we go into the dentist a few times, and they have to be on antibiotics before they go.
Gotcha.
Yeah, so any type of invasive thing. But think about the normal, like, routine childhood invasive things.
Sometimes are for
What do they do?
surgeries too, right?
Yeah,
Definitely,
surgeries.
prophylactic.
Yeah,
Yeah.
but those are easy guesses.
Yeah.
The dentist, everybody always misses the dentist. When you go to the dentist, they'll actually have you ever been told you should take antibiotics before you seek dental treatment? And you're like, what, who does that?
Now we know we're not gonna miss that.